Therefore, is the time this morning on the breakfast show. Okay, so like I did allude to just a while ago, I did say that I'll be joined by people coming from Cidrz, and I'll be introducing them just now so that they can tell us exactly what we are focusing on this morning. All right, so with me in the studio, I have Miss Mwiza Hambokoma, rather, goodness me, from the Center for Infectious Disease Research in Zambia, under the Social and Behavioral Science Unit, and Miss Rhoda Chigaba, who will be sharing her experience of recovering from COVID-19. Let's start with Miss Mwiza. Good morning and welcome to Radio Chimwemwe this morning.
Good morning. Thank you so much for having us. It's great to be in studio today.
Okay, and of course, just seated across is Miss Rhoda Chigaba. Good morning.
Good morning. How are you?
No, I'm pretty good. I'm pretty good. Oh yes. So, Miss Mwiza, I think let's pick it up with you. Can you just briefly tell us about the Center for Infectious Disease Research in Zambia, the Cidrz, and your role in the fight against COVID-19?
Yeah, thank you. Thank you so much. So Cidrz is a local non-governmental organization, and we deal mainly in health. So we've been working in this area for almost 20 years now. So this year is actually our 20th anniversary. We've worked mainly with the Ministry of Health and several other ministries, and mainly our mission is basically to improve access to quality health care, and we use various innovative strategies to do this. And one of those strategies at the moment is just being a member of the Risk Communication Community Engagement Committee. This is a committee made up of different stakeholders who come together to try and provide technical support and basically contribute to production and airing of preventative campaigns, just like this particular campaign that we've come here to talk about, the Hands, Face, Space, Surface campaign.
Okay. Right, of course, for the listeners out there, I think I'll urge you to pay attention because that later on at an opportune time will be asking some questions, and you could be walking away with some hamper. Yeah, they have come here. Christmas has come early, so they have come bearing gifts. So we'll be able to open the phone lines, ask you a question or two. Then if you get the question right, definitely you walk out with a hamper. Like I said, Christmas has come early. All right. So would you just kindly tell us about the password campaign that has hit the airwaves in the past 2 weeks?
Yeah, so the Hands, Face, Space, Surface campaign, I'm sure most people are wondering what is that all about. So this is some sort of catchy campaign just to remind people that, you know, there is a way that we can reduce the transmission of COVID-19. So when we talk about hands, basically it's just a reminder that we need to constantly keep our hands clean. So that's by washing your hands with running water and soap. In the event that you don't have running water and soap, you are asked to use an alcohol-based sanitizer. And then when we come to face, basically what we're talking about when we say face is just a reminder that each one of us needs to wear our face masks correctly, especially when we're in public. And what we mean correctly is that this face mask, you know, it should cover your mouth and your nose. And then when we come to space, it's basically just trying to remind us that we need to maintain a social distance, and I think we have heard the various guidelines that we've been given to either try and maintain 1 meter to 2 meters apart. And then when we come to, you know, the surfaces, I'm sure surfaces, people might not really know what that's all about. So in terms of surfaces, it's just the reminder for us to keep our surfaces clean. And here we're really talking about frequently touched surfaces. So that could be things like door handles, staircase rails, your phones, your chairs, your tables. And I'm sure some people will be surprised to hear that, you know, you should also sanitize your phones. But it's important, you know, a phone is also something we touch quite frequently. So you can just get, you know, a cloth, put some sanitizer, and wipe your phone down. So that's basically what the campaign is all about. It's just remind us to practice these simple behaviors.
Okay. All right, so also like we did allude to it, I think in the introduction, you've come with Miss Rhoda Chigaba, who has recovered from COVID-19. So maybe it's high time we brought you on board, of course, this morning. And much appreciated that you have agreed to share your personal experience with the public. Kindly just take us through your experience with COVID-19.
Thank you so much. So I was among the few people that had COVID, the first wave, and it hit me so bad. It came with so much force and pain, and you know, that the first wave came with a lot of myths and misconceptions concerning the COVID-19. So I was a bit hesitant to visit the hospital for 2 days when I was feeling those symptoms, until my family had to encourage me to say, no, these symptoms you are showing could be COVID. That's how I was taken to the nearest clinic for a test, and I tested positive. So I was given some medication just to boost my immune system, and when I was also advised to be in quarantine, to be on self-quarantine. So I went home and I went through the self-quarantine. From there, I experienced shortness of breath. I lost my sense of smell, my sense of taste. It was just a bad experience that we don't want to wish for anyone to undergo. And I had to also make sure that I follow all the guidelines that I was given by staying away from the public, and also just to put my family first. So I was quarantined in my room. People we used to communicate through the phone. I was not allowing children to come in contact with me or any member of the family. Yeah.
Okay, so I'm thinking here, before you caught COVID-19, what was your mindset prior to you contracting COVID-19? Were you thinking like some people are still pessimistic about COVID-19, thinking like it does not exist, I can't catch it? What was your mindset like?
Before, I was so scared actually. I was so scared of COVID, and I had those myths to say, no, this thing is for white people, I can't contract it. But again, what made me to also agree to say I should do the test, I was exposed. I attended a funeral which had, there were a lot of people at that funeral, so I suspect I got the virus from there. But me, like just looking at it as a person, I thought it wasn't going to hit me, but it hit me hard. Actually, whereby I couldn't smell anything. It's a very bad experience where you can't smell anything, you can't taste anything. Even if you get chima, you put in your mouth, it just tastes like you're chewing a bitter form. Yeah.
Okay.
It was very bad.
All right. So basically, speaking to people that have that pessimistic mind, even now, what would your advice be? My
advice would be, people, COVID-19 is real, and if we don't take it serious, we are going to lose our lives. It is real, and it's out there. It's up to us as individuals to take the golden rules, the 5 golden rules that we've been given. Actually, it's the 6th now with the vaccine. Yeah, to take them serious. It's out there, and we need to be conscious about it.
Okay, so the myths surrounding some of these vaccines that have come through, what is your take on that? Have you gotten your shot of? Have you been vaccinated fully, or you've just had your first shot?
I'm not yet fully vaccinated.
Okay.
Yeah, I'm getting my shot on Friday.
Okay.
Yes.
And you believe this vaccine is for the benefit of people, not to put politics in this matter?
No, there are no politics attached. It's for our well-being, this vaccine. If I've seen a lot of people are saying no, people are going to die after the vaccine. Others are saying after 2 years, people are going to die after the vaccine. But I don't think it has undergone through a lot of research worldwide. And we've seen a lot of people taking it. So why would it just be Zambia, where people will die after 2 years? I don't think that's correct. So I would urge the general public to really get vaccinated.
Okay, all right. Okay, getting back to Ms. Mwiza here. Before we open the phone lines, we can start asking maybe the listeners a couple of questions here and there, so they can walk out with some hampers. We did mention that the 10 lucky winners, 10 lucky callers, if they get the question right, they will walk out with something. We have a cap, a t-shirt, hand sanitizer, cloth, face mask, and a bar of soap that will be given out. So, Ms. Mwiza, just run us through the competition before we start taking those calls.
Okay, great. So, as we said, the password is hands, face, space, surface. So, our callers will just have to pick from those 4. So, for example, if caller number 1 picks from hands, we have some questions based about hands that they'll need to answer. If they pick face, again, they need to answer something related to face and space and surface as well. So basically, you just pick the 4 behaviors, and then we'll ask you a question related to that. So it's as simple as that.
Okay,
really.
so there's hands, face, surface, and space.
Yes.
You just basically say category,
Yes.
then we hit them with a question.
Yeah, boo.
Yeah, it's not trigonometry, so they shouldn't worry. It's not.
No. This is like really
Okay.
the things I think all of us know by now. Yeah.
Okay, so the number that gets you through to registration this morning is 0954 5934 and 36. 0954 5934 and 36. We have some hampers that will be given out here. So if you call, you get the question right, you walk away with something here. That is courtesy of Cidrz here. 0954 5934 and 36. And we already have our first caller. Good morning.
Hello, Barak.
Walisha mkwe?
Yeah.
Ibani
I'm
hapa?
Mr. Bagia, Wawira.
Okay, Mr. Bug, not quite hands, face, surface, space. Which category?
Yeah.
Maraso nitapamwisa tufumie question.
Wetu around from where to arrive somewhere in the staff,
Surface.
surface.
Surface. Okay. So question. Question you. What should be done to surfaces which are regularly touched?
Hey, tell me to Barak.
Fish filo kuchitika kuma surfaces yote ikata sana fili hapa pa ntiweka taikata sana fish mfilo kuchita Mr. COVID.
Refe yako ikindiriye babati otire twati. Hey, Baraki. Mwatimo na muntu uri ari tupoku kumu konkaisha. Mwe bacho uya ikataparia, uya ikatata mwato ile bare kitaparia. Kozi ngafika twovaze muntu aronko insara. Uya ikatapa mpoto.
Okay, Bug.
Hey.
I think too much for question. Na ibika so. Like pama stairs for example, ngamle kula ma step sign. Kwa ma handles mumbali fidia. So ila ma handles era instead ya COVID. Fish mufilo kustaira kuma safi kuma handles era pakwati wachingira COVID, ukishingira from COVID.
Kulena enda na sanitizer.
Okay.
So that ngira muromo difi fire moni kati kuna ikata sia pare sikwete kwa tuma hospital mu sia pare ja shani ma bed jama hospital shani ngira na sanitizer na ikata sanitizer nemu ne kumino yani utina kufuma oro ndefu mamuria kulena isa ikata sanitizer.
Okay. All right. So Miss Mwiza, are you comfortable? Does he walk out with something?
Yeah, I think we can give him something. I think he has tried his best, so we can give him something.
It's a little based. All right. So Bug, just we're taking note of your number.
Number and
To listen the number, but don't worry. So you're taking your number here. Then I'm sure I'll let the guide Mwiza how you end up with success in the prize. You know.
Yeah, they can come and collect from him.
Okay. So what happens? How is the procedure now?
Okay, so once all our winners, we know all our winners, we will get maybe they should come with their NRCs. They can collect their hampers right here in studio.
Okay. All right, so just come to the studio and you find your prize here. Okay, we have another caller, 0954 5934 and 36. Good morning.
Morning, how are you?
Very fine. Whom are we speaking to?
Wadi.
Okay, Babwadia. Not quite the space, surface, hands, na face. Which category mleso nitapomkwa? Shani? Face. Okay. All right. Okay. If one is fully vaccinated, should they continue masking up?
They will. They should continue.
Okay. Thank you very much. Atubana nisha mkwa. Hello?
Wadia.
Okay. Mr. Bwalia.
Congratulations.
All right. So you come to the radio station and get your prize line. Now NRC. Don't forget your NRC. Sure. Thank you. Okay, 0954 5934 and 36. We're taking those calls. I'm talking to people coming from Cidrz, and they have come with gifts here. Yeah, these are hard times, COVID-19 times. Yeah, and Christmas has come early. So just all you do is just call. We ask you a simple question. You walk out with something here. Yeah, I'm waiting for my my own hamper here. Good morning.
Good morning, Mr. Right.
Yes, tulanda nabani mkoa.
Ngera nina Kakamwendo zone.
Okay. Hands, face, surface, space. Category nshimkwa.
Hand.
Hands. Okay. Mention the basics of good hand hygiene. Mention the basics of good hand hygiene.
Hand sanitizer.
Okay.
Soap.
Okay.
Mkwa.
All right. Miss Muizo, do we have our third
You
lucky
can
winner
just give
here?
us a little bit more. What do we do with the hand sanitizer? What type of hand sanitizer? Even soap. What do we do?
Namufu by Shamko, sanitizer.
Again too.
No, continue.
I will continue feeling much on Kanyan Pomko.
Achimuletira tauko based on sanitizer. Mkwa.
Then na sopo.
Na sopo ine tambire yonse ngatapalian sanitizer. You can use soap na running water.
Correct. Thank you.
Sounds like somebody who practices. Okay, so Mwasa Talk Station Mwasa send prize 9. Okay, thank you. All right, seems like that's somebody who really
Practices.
practices that. Okay, trying to keep COVID away. Yeah, by mile. Okay, 0954 593436, 0954 5934 and 36. You already have had 3. Yeah, we've got 7 more lucky winners. Get calling. Hello. Hello.
Hello.
Mkwai, ni bani hapa?
Nako Boniface.
Okay, but Boniface, hands, space, surface or face? Category nshimkwai. Face. Okay, what parts of your face should be covered when wearing a face mask?
Uidinganya ndawafala face mask. Waifala buino. Wamaking sure tinyona na kanwa yonse na uchingirira.
Okay.
Correct.
Okay, so the quality makwela we have seen some people ngawa in public transport ngawa kwela from bus no kasashako. So that's why they pay more, not realizing that you're actually just exposing yourself to COVID-19. Okay, so mwasa pita radio station mwasa send hampa ya noin.
Ni di dadi.
Nangfa ni mwasa pita ko nangulelo, no problem.
Okay, get up on my.
Yeah, okay, don't forget NRC ya noin.
Okay.
Thank you. All right, so 4 down, 6 more to go. We're still taking those calls on 0954 593436. Alternatively, 0961 9179 and 17. 0961 9179 and 17. It's raining calls here. Good morning.
Good morning. How are you, sir?
I'm very fine. Whom am I speaking to?
Roy.
Okay. Hands, face, surface, and space. Categories. Face. Okay. Which happens to be actually our last question from face. What parts of the face should you avoid touching so you don't risk contracting COVID-19?
You avoid touching your eyes, nose, and mouth.
Okay. Miss Muiza?
That's correct.
Okay.
Thank you. Congratulations.
Okay. All right. So you also equally just come through to the radio station and get yourself your prize. Just to make sure that you come with your NRC.
Okay.
Thank you very much. All right. So far, sounds like people are really now warming up to COVID-19. Whatever guidelines have been put across, feels like people are not taking things lightly. All right. So you have 3 more categories. You're done with face. 0954 5934 36, 0954 5934 and the 36 gets you through to Radio Chimwemwe this morning. I have with me Miss Muiza as well as Ms. Rhoda, who was recovered from COVID-19. And if you were listening to the artist from the start of the program this morning, you would understand because she's speaking from experience. So that's not something that you take very lightly. Good morning.
Hello.
Yes, tulanda na bani mkwe.
Nanda na Loveness Gundola Kalopo.
Okay. Mkwe wa Loveness not kwa tama categories hands, space na surface. Twala mipisha question mfuma mwisa.
Mondi pishimo
Hands umo. Okay. Okay, what is the recommended time for proper hand washing? This is a good one. What is the recommended time for proper hand washing? Ngamale samba kuminwe. Mfuni taking inshtai if inshtai filale pam ufika parishani mkwa.
Sure to asamba regularly steve idi wape.
Kwa diba like kusamba kuminwe fidia insta. Ngamale penda minutes, ngama minutes, mfima fia pala ko fidia.
5 minutes.
Loveness, try again. 5 minutes.
Loveness.
Try again, Mama, try again.
Sorry. This is one thing I've actually observed. Because if you go around the cities just across the country, you find that people are more inclined to using sanitizers than really washing their hands. So that's why I think maybe is that now we are hearing of 5 minutes.
Yeah.
Okay, 09545934 and the 36 gets you through. Good morning.
Morning.
Yes, whom are we speaking to?
Julius.
Okay, but Julius, not quite hand space na surface. Tolami pisha kumamwisa. Face. Okay. Right. So where is the face? Face na ipomko. Face na ipot. Hand space na surface. Hands. Okay. What is the recommended time for proper hand washing?
20 seconds.
20 seconds. There's somebody. Okay.
Congratulations.
All right. So at least 20 seconds. Don't pick up a mishi. You have to really kind of rub really good, really give the hands a very good wash. Okay, just taking note of your number. Then my station Kumasa and prize 9. Just make sure don't forget your NRC because Masanga to Ivambiwa such tips. So please come with your NRC. Okay, thank you. Let's winner number what?
Number 6.
Okay, so we have 4 more. Yeah, 4 more lucky callers. Get calling on the 0954 5934 and the 36 gets you through to program. Okay, I think we have another one. Good morning.
Hello, la buena na cabina para please.
Okay, well, loveness.
Okay.
All right, so hands, space, na surface. Space. Okay. What is the recommended distance to keep between you and the next individual to avoid transmission or contracting the COVID-19 virus?
1 meter.
Spot on.
Congratulations. Well, Loveness wants a hamper.
Yeah, she really wants a hamper. Yeah.
Congratulations.
Atatoka mukulusa fiance mwandini. Empashwe wa Loveness, empashwe.
Yekaida le kala kumushabe na tuma ngombe.
Okay, thank you very much. Okay, so once I go to station 9, Pampelembe House, 7th floor. Yeah, I'm going to send her present. Okay. All right, 0954 5934 and the 36 0954 5934 and 36 gets you through to the program. Good morning.
Good morning.
Yes, your name and where you calling from?
Manu, I'm calling from Owamuda.
Okay. All right, space, surface, hands. Space. Okay, when must physical distancing be observed? When must... What?
1 minute.
No. When must physical distancing be observed? Nishtanshi yomulingi lokishita observe okulabika distance between yourself na abantu. Nishtanshi.
When in a crowd spaces.
Okay. All right.
Yeah.
Thank you very much. It appears like we have got like winner number what?
Number 8. 2 more to go.
Okay. All right. So at by nani shinamkoi.
Emmanuel.
Okay. By Mano my radio station. I send prize 9. Naka NRC Fefilafine.
Okay.
Thank you. All right. 2 more to go. 0954 5934 and the 36 0954 5934 36 gets you through to station. Good morning. Hello. Yeah, I'm quiet. Okay, but Bug, I think what you do is call after the program, then we'll be able to guide you. Okay. Okay, in the interest of time, I think you can call. Then after the program, I'll be able to guide how best we can probably give you your hamper here. 0954 593436. Good morning.
Nadi. Yes, good morning.
Naidi namkwaye, yeah. Barishani.
Wena mwachani.
We know, nibani aba.
London now in Luvuto.
Quite okay. Finally, somebody from Luvuto. Space, surface, na hands. Alafu mimi kuisa question mkwai.
And
Hands. Okay. Which happens to be the last one. Which one is more effective between soap and hand sanitizer? Iwo mbapo buno sana. Iwo mbapo buno sana. Padi soap na hand sanitizer nishi.
hivyo ambapo unasana padi soap na hand sanitizer. Ni hand sanitizer.
I think, in all fairness, I think, what do you think, Miss Muiz? We should do this.
Maybe she can go a bit further. Why hand sanitizer?
Tumalunda ko pano no pomkwai.
Oh, for hand sanitizer. Okay, hand sanitizer irabo yari very effective, and then you can even guys see why you want anytime.
Okay.
We can give it.
Okay,
we can give it to her for that.
Yes, yeah. For convenience's sake, you can carry this anywhere. Yes. Yeah, like I do. I have mine there. Okay. Actually, it's right now, so I'm glad ciders are here, so I'm sure they'll give me a refill before they leave here. Okay, I can send the number, then it's Bananish Namkoi. Okay, Naomi from Luvuto. Okay. So my Sakura radio station, 9RC.
No.
Okay, so one more. Okay, thank you very much for calling through. 0954593436, 0954593436. We only have a surface and space remaining. We're done with hands and face. It appears like the surface, people are not really into the surface here. Good morning.
Morning, how are you?
Very fine. Whom are we speaking to? Okay, we have lost that one, unfortunately. 09545934 and 36 gets you through. The lucky last caller. Okay, Christmas has come early here. Who's going to be walking away with something this morning? Hello. Good morning.
Good morning, thank you.
I'm going to Okay. All right. Tushelefe na space na surface. Alafu nyamusa question mkoi.
Space.
Space. Okay. Mention at least 2 surface areas regularly touched that should be cleaned and disinfected. Mention at least 2 surface areas regularly touched that should be cleaned and disinfected.
Okay. Door handles. And door handles and more especially for those who use elevators and escalators, all those spaces should be cleaned.
Okay. Yeah, it's a unique one as well, but it's true. You have escalators, the handles.
Okay.
Yeah.
All right. So, Mr.
Malama,
you're the 10th lucky winner. Come through to Radio State, to Radio Chimwemwe, Pelembe House, and you'll find your prize right here.
Thank you so much. And I would like also to encourage others. I'm also the survivor of COVID.
Okay.
Just past 2 months ago, I was tested positive, but fortunately, I followed the guidelines. Here I am. I'm just okay. I'm fine.
Okay.
Thank you for sharing.
Thank you.
Sure.
All right. Thank you very much. All right. So as we conclude, unfortunately, all good things come to an end. So as we conclude, we could have gone on, I think, the whole day just giving out, these things. Yes, hampers, left, right, and center. But we have to go. As we conclude the program, starting with you, Miss Muiza.
Closing remarks,
Sure.
hands, face, space, surface. I think this is a call to action for all of us. We can practice these simple behaviors. Thank you.
Okay. And to our very own COVID recovery survivor, she recovered, and she's a testimony here in the studio, just like the previous caller.
Yeah, so my word of encouragement is that COVID-19 is real. Let's stay alert and let's practice hands, face, space, and surface practice to keep ourselves safe from COVID-19.
All right, thank you very much. So that wraps up today's program. Been talking to people coming from Cidrz in this program where we've given out some prizes for some lucky callers here. And of course, talking to Miss Muiza Ambokoma from the Center for Infectious Disease Research in Zambia at Cidrz. and of course Ms. Rhoda Chigaba, who was sharing her personal experience of recovering from COVID-19. Thank you very much. For now, take a break. Be back on the other side.